This is all about filling in the gaps that original Medicare does not cover, and if you're just coming off of episode 1, you understand that those gaps are significant. In general, there are 2 different routes that you can take. Both of these are designed to fill in the gaps of original Medicare, but they accomplish this in very different ways. The first would be Part C, more commonly known as Medicare Advantage plans, and the second would be Medicare Supplement plans, commonly referred to as Medigap plans. I'll go over how both of these work, and then I have a head-to-head comparison for you at the end of this episode. Let's start with Medicare Advantage plans because they continue our part alphabet letters with Part C, and alphabetically they come first. Important details around Advantage plans are that you must have Medicare Parts A and B to get a Medicare Advantage plan. Medicare Advantage plans are offered by private insurance companies who take the risk and responsibility away from original Medicare. You still must have original Medicare, but the Advantage plan is replacing original Medicare. This means that instead of bills going to Medicare to pay first, all of the bills are going to the private insurance company. The companies that offer these must cover everything that original Medicare covers, but they do not have to cover it in the same way, and I'll get to more around that in a minute. Medicare Advantage plans are a bundle of different healthcare-related benefits. They include hospital coverage, replacing Part A. They cover medical coverage, replacing Part B. They usually come included with prescription drug coverage, which is Part D and covered in Episode 3. And they usually come with several other perks like different levels of dental, vision, and hearing coverage, gym memberships, transportation benefits, meals after being released from the hospital, and others. So what does all of this cost you? Well, 73% of all Medicare beneficiaries who have Medicare Advantage plans pay $0 in premiums. So the big draw to Advantage plans are the fact that they have low or more often no premiums, and they come with all of these benefits packaged into one plan. Last thing on what an Advantage plan is managed care. This means that the insurance company does have some say in your healthcare decisions. You would have a network of approved providers. With some plans, if you go out of the network, you're responsible for all of the costs. With other plans, you can go out of network, but you would pay more in co-pays and co-insurance. One very important note on Advantage plan networks is that if you have an emergency and you visit an out-of-network provider, the Advantage plan is required to treat the emergency as in-network, even if you go to an out-of-network hospital. So if you're traveling and an emergency happens, you do have in-network coverage. However, it must be a true emergency and be billed as such by the provider. And yes, most plans even include emergencies that happen outside of the U.S. It's typically a reimbursement arrangement, meaning that you would pay for the care outside of the U.S. and then submit your receipts to the insurance company who would reimburse you again for emergency care. All right, with Advantage plans, you will have things like copays and coinsurance up to a maximum out-of-pocket. The insurance company could require prior authorizations for certain procedures and deny certain things if deemed medically unnecessary. These work very similarly to a group plan that you've likely experienced for much of your life. Let's talk about what these are not. Advantage plans are not original Medicare. Again, you need original Medicare to get the Advantage plan, but the Advantage plan replaces original Medicare coverage. Advantage plans are not standardized. Different companies have different benefits, networks, premiums, copays, coinsurance amounts, and maximum out-of-pocket numbers. Related to that, Advantage plans are zip code specific, meaning that Advantage plans are not available everywhere, and this actually opens up a pretty important rabbit hole. I would venture to say that the vast majority of Medicare marketing out there promotes Advantage plans. You'll see commercials and celebrity spokespeople talking about all of these amazing benefits, and yes, Advantage plans are great for some people, but those benefits that commercials list off are not available everywhere to everyone, so just be careful around Medicare marketing. All right, to get an Advantage plan, you have a window. That window is called the initial enrollment period if you're going on an Advantage plan when you are near 65. That window begins 3 months before your 65th birthday. It includes your 65th birthday month, and it extends 3 months after your 65th birthday. If you're going on Medicare at 65 and you want an Advantage plan, this is the window that you'll want to use to get that Advantage plan. If you delay Medicare past 65, you will have a special election period once you come off of your group plan, as we discussed in episode 1. You have 63 days following a qualifying event to pick up Medicare Parts A and B and then an Advantage plan. The last enrollment period is important for those who are on Advantage plans, and that would be the annual enrollment period, or AEP. This happens every year from October 15th through December 7th, and this is a time where those who have Advantage plans can change to another Advantage plan if they so choose. Any changes would begin on January 1st of the upcoming year. If you choose an Advantage plan and later want to switch to a supplement plan, things can get tricky, so we have a deep dive video on all of that on our YouTube channel that goes into switching from Advantage plans to supplement plans. Okay, speaking of supplement plans, let's talk about those. Some important details. Like Advantage plans, to get a supplement plan, you must have Medicare Part A and Part B. Like Advantage plans, supplement plans are offered by private insurance companies, and that's where the similarities stop. Supplement plans pay secondary to original Medicare. This means that if original Medicare covers something, the supplement plan covers it too, no questions asked. Supplement plans fill in the gaps of original Medicare that we discussed for Medicare Part A and Part B, specifically those copays and coinsurance amounts, and typically, that's it. Unlike Advantage plans, supplement plan coverages are standardized. There are 10 letters to confuse us more with the Medicare alphabet soup, but each Medigap plan letter has specific coverages. A Medigap Plan G in California covers the exact same thing as a Medigap Plan G in New York. A Plan G from one insurance company covers the exact same thing as a Plan G from another insurance company. These plan letters are standardized. Now, for years, Plan F was the most popular because it had the least amount of cost responsibility in the form of deductibles, copays, and coinsurance. However, Plan F is now only available to those who were eligible for Medicare before 2020. If you became Medicare eligible on or after January 2020, you cannot get a Plan F anymore. Plan G is now the most popular option because once you pay the Part B deductible, your Plan G will cover 100% of the remaining costs for any Medicare-approved services. So all of those big scary deductibles, copays, and coinsurance amounts that we discussed in episode 1 that are related to Parts A and B, covered by the supplement plan with no lifetime maximum to worry about. But that coverage comes at a cost. Supplement plans are not $0 premium plans. You will need to pay a monthly amount to get one. Most plans are age-based, meaning your plan will cost a certain amount once you reach 65, but once you reach 66, you are a year older, and therefore you will pay more. In addition to that happy birthday increase, most insurance companies also have increases each year to account for inflation and rising healthcare costs. So it is common for supplement plans to potentially have 2 premium increases in 1 year. Other plan types are called community-rated plans or issue age plans. These plans are not based on you attaining a new age, so you aren't getting that happy birthday increase, but you would still see relatively regular increases from the insurance company to account for inflation and rising healthcare costs. Now, premiums vary dramatically depending on which state that you live in and the insurance company that you pick. As an example, in some states, a Plan G could cost less than $100 per month for a 65-year-old. That same plan in a different state could cost $300+ per month. So where you live matters. All right, let's talk about what a supplement plan is not. A supplement plan is not a managed care plan, meaning you do not have a network. You may visit any facility or provider in the country as long as that facility and or provider participate with Medicare. This does not mean that they accept Medicare patients. It means that they participate with Medicare and they accept the Medicare fee schedule. Similar to Advantage plans, supplement plans can offer emergency coverage outside the U.S. under the same reimbursement model. Medicare supplement plans do not come with all of the perks that Advantage plans have. Supplement plans do not cover dental, vision, or hearing. They don't have the transportation benefits or meals. Most don't have gym memberships. However, there are some companies that do throw one of those into their supplement plans. The point is that you are paying strictly for filling in the copays, coinsurance, and deductible gaps of Part A and Part B, and that's it. Finally, supplement plans do not cover prescription drugs or Part D. With Part D plans and any of those other plans like dental, vision, and hearing, you can pick up those as standalone plans that will have their own additional monthly premiums, copays, coinsurance amounts, and maximum out-of-pockets. Supplement plans have their own enrollment period, which is different than an Advantage plan. This window starts on your Part B effective date. Remember that it is always on the first of the month. And this window ends on the last day of the 6th month following your Part B effective date or start date. If you sign up for a supplement plan in this window, you are guaranteed to get it at the rate that matches your age or the standard community rate. It doesn't matter if you have pre-existing conditions or serious health issues, you're guaranteed to get these plans. The reason this window is so important is because in most areas of the country, if you try to get a supplement plan outside of this window or outside the special election period here, you would need to answer medical questions, and the insurance company could charge you higher than normal rates or deny you completely. So this is an important conversation to have with your agent who helps you with Medicare. Supplement plans don't really fall into the same rules under the annual enrollment period. However, most people get a standalone Part D drug plan, and that is impacted in this enrollment period. But we talk more about Part D in episode 3 coming up soon. To finish off this episode, let's do a head-to-head battle between Advantage and supplement plans to see which one comes out on top. The first category is the premiums, the monthly amount that you need to pay just to have these plans. Most Advantage plans are $0 premiums or very low. Supplement plans come in at between $50 and $300 plus per person per month. The clear winner of this round is the Advantage plan. The second category would be cost sharing. These are the out-of-pocket costs that you would need to pay once you use the healthcare system. Advantage plans have copays and coinsurance amounts up to a maximum out of pocket. Supplement plans have the Part B deductible with the exception of Plan F, and some of the letters have copays, but they are small. The winner of this round is the supplement plan. The next category would be drug coverage. A Part D prescription drug plan is usually included at no extra cost in an Advantage plan. Part D coverage is not included with a supplement plan, and you would need to purchase a drug plan separately. This can be a positive because you can pick and choose which Part D plan you want rather than the standard one that comes with the Advantage plan, but we would give the winner of this round to the Advantage plan, since the drug plan is included at no additional cost. Round 4 involves the network. Advantage plans have a network of providers and facilities that you'll want to stay in to ensure that you don't pay more or all of your healthcare costs. Supplement plans do not have a network. They pay secondary to Medicare, so as long as the provider or facility participate with Medicare anywhere in the country, you're good to go. The winner here, supplement plans. Round 5 involves other perks. Advantage plans come with things like dental, vision, and hearing coverage, gym memberships, and other perks, all at no additional charge. Supplement plans just don't. Again, some, not all, have a gym membership, but the perks with supplement plans just don't compete with the Advantage plans. When you're here, Advantage. The last category would be administration, meaning how easy is it to use the plan once you need it. Remember that the insurance company replaces original Medicare with an Advantage plan, so the coverage and the policies are dictated by the insurance company. They are bound by regulations from the government, so they can't go rogue and deny whatever they want, but they do have prior authorization procedures and denials that do come up. A supplement plan pays secondary to Medicare, meaning if Medicare covers it, the supplement plan covers it, no questions asked. The winner here, the supplement plan. As you can see, we are all tied up, and this is on purpose. Medicare is not a one-size-fits-all approach. Every person weighs these categories differently. You may feel lower fixed costs in the form of low premiums is most important, and you don't mind networks. Or you may prefer low risk in the form of cost sharing and the freedom to choose any doctor. Advantage plans work amazing for some people and terribly for others. Supplement plans are perfect for some people, but awful for others. It's important to sit down with somebody who understands this well to go over your situation and options available to you. Okay, that wraps up episode 2. Episodes 3 and 4 are much shorter, but very important.